There is lung cancer, liver cancer, but why have we never heard of heart cancer? Is the heart an invincible organ? Cancer is a scary disease that sounds scary. On average every year it takes the lives of up to 8 million people around the world. Some common cancers to mention include breast cancer, lung cancer, thyroid cancer, but there is an extremely important part that is inexplicably forgotten in this list. And that is the heart. If asked if you have ever encountered a case of heart cancer, 99% of the answer would be no. So does a disease called heart cancer really exist? The answer is absolutely yes, however it is super rare, so many people think heart cancer only exists in the imagination. First of all, let's try to learn a little about cancer. Our bodies have an elimination system in which old, poorly functioning cells are removed and replaced with new cells. However, in some cases when this mechanism fails, poor quality cells will continue to grow. When these mutant cells multiply, they will disrupt the function of neighboring cells and, at a certain limit, they will go out of control, creating a tumor. This means any part of the body can get cancer, not just internal organs. Returning to the case of the heart, this is truly the busiest organ, because it works non-stop from the moment we are born until we say goodbye to this life. With such a 24/7 continuous responsibility, the heart doesn't even have time to remove old cells and replace them with new ones. Heart cells stay that way almost forever, unless there is tissue damage. And so cancer has almost no chance of invading because the process of cell replacement in the heart rarely occurs. However, rare does not mean absent. Research shows that for every 1 million people, about 34 people are at risk of heart cancer. Cases of heart cancer are divided into two types. The first type is cancer cells that grow directly from the heart, bringing with it an extremely high mortality rate, but fortunately it also happens very rarely. In the remaining form, cancer from other organs such as the lungs or blood spreads to the heart and gradually forms heart cancer. The chance of a patient surviving this disease is only about 50% after the first year. Although heart cancer is extremely rare, it is truly a dangerous disease that needs to be researched carefully. That said, our hearts are not immune to cancer as many people mistakenly think. What are the symptoms of heart cancer? The extreme scarcity of heart cancer is generally a positive thing, but it means we're really lacking accurate data on the disease, making it difficult for doctors to tackle it. For example, it's still unclear whether any specific lifestyle choices or health conditions increase the risk of heart cancer. It's not even clear how or why heart tumors arise or how best to treat them. We don't know what the risk factors are, said Dr. Tochukwu Okwosa, a cardiologist and director of cardio-oncology at Rush University Medical Center in Chicago. What specifically causes patients to develop heart cancer? Symptoms of heart cancer can also be difficult to identify. Some tumors are asymptomatic, while most others cause only nonspecific symptoms, such as fatigue, shortness of breath, dizziness, chest pain, and palpitations. If you feel uncomfortable and notice any of these symptoms, it is unlikely to be a heart tumor, but you should have it checked by a medical professional.